It is particularly common in the head, body and joints. Pain. But where does pain come from, and how do pain relievers work? In response to a trauma, a person only feels pain once the affected cells have reacted to it and have started transmitting pain messages like this. The cell membranes immediately release fatty acids, shown here as long red chains. The fatty acids enter an enzyme cyclooxygenase anchored in the cell membrane. This enzyme now functions as a kind of catalyst. The fatty acids arriving at the enzyme are transformed and come out again as pain messenger substances such as histamine and prostaglandins, shown here as a yellow cone. These messenger substances are an exact fit for pain receptors on the nerve endings. There, they die, and the stimulation thus caused is sent as an electrical signal to the brain via the nerve fibers. The brain receives the information and evaluates it. Only then does the person feel pain. Ouch! The entire complex process takes place in a split second. Now, after swallowing an aspirin tablet, it will go on a journey through the digestive system. The tablet will travel down the esophagus into the stomach, where it is dissolved into smaller particles. These particles will continue their journey into the small intestine, where most will be absorbed into the bloodstream. The smaller intestinal walls, also called lumen, aligns with tiny villi where nutrients are absorbed. Looking closely with these villi, you can see they have a rich blood supply and they are covered in a thin layer of epithelial cells. Aspirin molecules will work their way through the epithelial cells and into the bloodstream, where they are carried around the body. Blood plasma contains complex molecules called albumin. Albumin is a protein made by the liver which transports nutrients around the body. Here, you can see some of the aspirin molecules binding to the albumin. All the aspirin particles are to be bound will be filtered out as they pass through the liver, and only the remaining aspirin molecules will get through and have an effect on the body. Different drugs will bind to albumin in different amounts depending on their definitive plasma protein. The aspirin-rich blood will enter the liver through the hepatic vein at the bottom and will exit at the top via the hepatic vein. At this stage, even more of the aspirin will be removed. The liver's job is like a filter. They will metabolize drugs before they reach the rest of the body. Aspirin will continue its journey to the rest of the body, including the sites of pain. Aspirin interrupts the transfer of information. The active ingredient in aspirin, acetylsalicylic acid, affects an important interface in the process. Specifically, the points where the pain messenger substances are created in the cyclooxygenase. The active ingredient simply blocks access to this enzyme. As a result, fatty acids can neither find their way into the catalyst, nor they are transformed into the pain messenger substance. Less and less pain messenger substances are transmitted. When fewer and fewer pain messenger substances die, the nerve endings send correspondingly fewer impulses to the brain. The result, the pain abates. A simple principle with a great effect. The active ingredient in aspirin, acetylsalicylic acid, is expelled quickly and effectively, whether in the head, body, or joints. Any remaining aspirin in the blood will go round and round the blood supply, going back through the liver several times until it is all used up or filtered out of the body. It travels into the kidneys and then into the bladder for excretion.